If you're one of the many people suffering from acid reflux, you're not alone. NBC 26's Cassandra Duvall explains how surgery might be able to help you.
It's time for Medical Monday. Dr. Anna Pierce with Aurora BayCare is here. We were talking about something that not a lot of people might know about, anti-reflux surgery. So many people suffer from reflux and things like that. So explain what that is, first of all.
Sure. So reflux in general, we're talking about kind of the things you and I would think about, the commercials with the terrible heartburn right after a big spicy meal. Some people experience that occasionally. Some people unfortunately experience it 2-3 times a week. It's overwhelming, lifestyle limiting, and they're requiring medications to control their symptoms. And it may not just be the pain, it may be they can't sleep lying flat because they get bad regurgitation, sour taste in their mouth. People with respiratory problems can have exacerbation of that just because of all of this acid getting up in their throat.
So that's the extreme. These are the people who might be good candidates for the surgery.
Of course. Ideal candidates for surgery are people who are dependent on medication to control their symptoms. So they have these symptoms at least 2-3 times a month and need their medicine every day in order to be comfortable. So we talk to them about surgery, and usually it's people who they're just either sick of taking the medication costs too much, or they don't like the side effects. So that's probably the most common group of people we see.
So briefly tell us about the surgery, what it entails and things like that.
So it is probably one of the most exciting procedures we perform as a surgeon because the effects are pretty much immediate and pretty life-changing for people who have it. So it's a minimally invasive surgery. So we perform it laparoscopically, which is with tiny incisions in the upper abdomen. We have a camera in there and some small instruments with a camera to guide us. And we take kind of the top floppy portion of the stomach, we wrap it around the lower part of the esophagus. So as the stomach expands, we have this new flap valve mechanism so that things don't, as the stomach gets bigger, all the acid that's in there doesn't come back up into the esophagus.
Oh, wow. And you, like you said, it's almost immediate, right?
Yes, we expect them to usually go home the next day after surgery off of any of their antacids if they can lie flat while they sleep and shouldn't experience the regurgitation that they had before surgery.
That's incredible. So like you were saying, recovery time, just a day in the hospital probably.
A day in the hospital. We have people on something of a modified diet to kind of slow back into things.
Because you don't want to be doing the spicy foods and the big meals and things like that, right?
It's kind of softer foods, lighter foods for a couple of days to weeks. But usually it's a minimally invasive surgery. Pain is minimal. They should be back up to their regular activities, minus the antacid medication pretty quickly.
And for somebody who, I mean, this is life-changing for them, isn't it?
For a lot of people, and I mean, we think about heartburn and we think about, you know, the people who just have a bad meal and you know you're going to get it. So
just a little inconvenience.
Exactly. But there are people whose lives are dictated, what they eat, what they do, how they sleep because of this heartburn. So it's very awesome to see some people just really liberated from their medications or from other things by this simple surgery.
All right. Thanks so much for being with us, Doc. For more information about this acid reflux surgery, visit our website and click on the Wisconsin Tonight section.